Hey everybody, welcome back to the ECG channel. My name is Reid and here we've got the daily ECG. Don't forget to download the PDF in the description so that you can follow along and have your own copy of today's ECG. And so, yeah, let's go ahead and get into it. So first thing we're going to do is what I call look at the forest. And what you'll notice is while we're looking at the forest here, this is not a normal ECG. This is a rhythm strip, and this is from a Holter monitor, which a Holter monitor is a wearable device from anywhere up to like 24 hours to 7 days, 14 days. And what this does is it records your rhythm. And so we just get a rhythm strip, and here you'll notice that we've got two consecutive strips here, and we'll take a look at, just figure out just from the strip alone what is going on. And so when I look at this, I see that I've got narrow QRS here. These are two different strips, so this is essentially strip 1 and strip 2. They're not the same. So we've got a narrow QRS here, and then we've got a quite significant pause that you'll notice, this pause here. And then we have the resumption of beats again. And so first let's just figure out what we think is going on with this rhythm. So what I'll notice here is before the pause occurs, we've got a narrow QRS, which makes me think that this QRS ventricular contraction is being triggered by conduction through the AV node, and we see that right in front of it we've got this nice P wave here. And then all of a sudden we've got this pause, and so the pause we need to figure out, is the pause happening because the sinus node stopped working or because there was an AV block? What is the cause of the pause here, this rhythm? And so when I look here, I look for any P waves. I'm looking for P waves, and all I see is a flat baseline. So here I see no P waves. And so that tells me that likely this is because the sinus node stopped working. So if there's no P waves, that means that the sinus node is not beating. And so we get this pause here, and so we would call this potentially a sinus pause or a sinus arrest. I want you to remember that a sinus pause is less than 3 seconds, and a sinus arrest is greater than 3 seconds. And so when you look here, you can see that this is a pause that doesn't last for too terribly long, and I'm not going to count it out exactly. And then all of a sudden, we get the resumption of the beat here. And what does this beat do to resume? Well, I see that we've got P wave that occurs before the QRS, and then we have another P wave here before a narrow QRS. So what can we designate this pause as? So this pause here that we saw throughout would be a sinus pause. And then we see a resumption of our sinus node. So we have a brief sinus pause, and then let's take a look at our next strip. So here I notice that I've got narrow QRSs. This is obviously the same patient. Narrow QRS again. You see I've got P wave before the QRS, and then once again we have what seems to be another long pause. I look for P's. I don't see any P waves here that are missing any QRSs, and so there's no P's. So once again we have another sinus pause. But what you'll notice is that we get this beat, the next beat that comes up looks different. This beat looks different, it looks a little bit wider, it's got a different morphology. And when I look in front of this beat for any P waves, I don't see P waves that are occurring in front of this beat. So I don't see any P waves before this beat, and I see a funky looking QRS. And so we would designate this as a ventricular escape beat. So what does that mean? So that means that the sinus node stopped working, we get this long pause, and then we get a beat that does not have a P wave in front of it. So this beat right here with this green arrow, this beat does not have a P wave in front of it, so that means that the atria didn't cause the depolarization. If you look at the morphology of the P wave and compare it to the previous, if you look at the morphology of the QRS and you compare to a normal QRS like this one that's conducted from the AV node. We know it's conducted from the AV node because of the P wave in front of it. You can see that they're different and that this second one, in fact, might be a little bit more wide. It's wide, at least compared to the original beat. And so because of that, we can say that this would be an escape beat that is likely come from somewhere in the ventricles. So it's a ventricular escape. That's your heart's way of saving your life. And so this is just an interesting rhythm, right? This person, you're trying to figure out maybe why they're passing out, what's going on. And you notice that we've got these frequent sinus pauses. And sometimes with the lack of developing an escape beat other than this ventricular escape beat. Normally, when the sinus node fires up here, and it fires and we get ventricular depolarization, that's usually what causes our P waves. But when the sinus node stops working, and when our sinus node doesn't work anymore, we rely on escape beats to contract our ventricles. So oftentimes we get a junctional escape beat, and junctional escape beats cause depolarization down to the ventricles at a rate of 40 to 60 beats per minute, and that can keep you alive. But if you're unable to generate this junctional escape beat, and we know that they're not because we don't see any during our pauses, then you're relying on these ventricular escape beats. And sometimes those beats are too slow. So this person needs a pacemaker in their atria to help them in the setting of these sinus pauses that are a little bit too frequent. So I hope this helps. If you have any questions, throw them in the comments. Don't forget to like and subscribe to the page. And yeah, have a great day.